Part A. Extract 1. Questions 1 to 12. You hear a physiotherapist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. I'm Hayden Park, your physiotherapist today. Let's start with what brings you in.
Hi. So, it's been a bit of a saga, honestly. I've had this recurring ache, sort of deep set, in my left shoulder and upper back. It's not sharp exactly, but it gets worse after I've been sitting for long periods, like working at my laptop. At first, I thought it was just poor posture or tension, but it's been going on for about 4 months now and actually seems to be spreading down toward my scapula and sometimes even into the triceps area. Some days it even feels like a low-level burning sensation.
Okay, sounds persistent. Can you describe exactly when it flares up?
Yeah, so it's worst after a long workday. I'm a graphic designer, so I'm basically glued to my chair for 8 to 10 hours a day. I've tried to make my workstation ergonomic, got a standing desk, repositioned my monitor, all of that, but the discomfort persists. It can even wake me up at night. Occasionally, there's some numbness radiating into my fingers, mainly the ring and pinky ones, which kind of freaked me out.
That's useful detail. Have you noticed any associated headaches or neck stiffness?
Oh, definitely. I get these tension headaches, like a tight band around my forehead, and sometimes I can barely turn my head to the left when I wake up. I also clench my jaw a lot. I think it's stress-related, but I'm not sure if it's all connected.
Sounds like we're dealing with multiple contributing factors. Mihira, have you tried any remedies so far?
Too many to count. I've done YouTube stretching routines, used a foam roller, bought one of those neck massagers with infrared heat, worked temporarily, but nothing lasting. I saw a chiropractor a few times too. They said I had mild cervical misalignment, but I didn't feel any long-term change. I even tried acupuncture, but it made me more anxious than relaxed. I did take ibuprofen occasionally, but I don't want to rely on medication.
Understood. Mihira, based on what you've described and what I'm observing, it's likely you're experiencing myofascial pain syndrome, essentially chronic muscle tightness and trigger point sensitivity, particularly in the levator scapulae and trapezius regions. Your symptoms also suggest some postural dysfunction and nerve impingement, probably due to prolonged static positioning.
So, not a disc issue or anything serious.
No signs of disc herniation from what you've said, but we'll rule things out as we go. For now, we'll focus on soft tissue release, postural retraining, and strengthening exercises.
Okay, and what does that involve exactly?
First, we'll start with manual therapy, including myofascial release and deep tissue massage, targeting the cervicothoracic junction. Then I'll show you a series of isometric scapular stabilization exercises and thoracic extension drills to counteract your forward posture. We'll also introduce neuromuscular re-education to restore optimal movement patterns.
Sounds intense.
It's progressive, Mihira. Initially, we'll keep the sessions gentle and build up tolerance. You'll also get a home exercise program focusing on pectoral muscle stretching, rhomboid activation, and eventually core engagement for postural support. I'll also assess your workstation setup more closely and suggest micro-break strategies.
Will I need to come in weekly?
Let's start with twice a week for the first 2 weeks and reassess. If things improve, we'll reduce frequency. Long-term, the goal is self-management and symptom prevention.
All right. Thanks, Hayden.
Extract 2. Questions 13 to 24. You hear a nurse talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, I'm Nurse Steers. What brings you in today?
Hi. Well, I've been having these really uncomfortable bloating episodes, and I'm just constantly tired. But it's not just that. There's this gnawing, sort of dull ache in my lower abdomen. Sometimes sharp, especially late at night. I keep waking up feeling like I haven't slept at all. And lately, I've been getting mild headaches, dull pressure type ones, and my clothes feel tighter, though I haven't changed anything major in my diet. I think,
And how long has this been going on?
honestly, about 3, maybe 4 months now. It's been gradual. At first, I thought it was just a phase, like maybe hormonal or premenstrual, but the bloating and fatigue are getting worse. I've also noticed I'm snacking at odd hours, like right before bed or even at 2 a.m. And weird cravings, salty stuff mostly, like chips, and sweet things like chocolate-covered almonds, which I didn't used to eat much of before.
That's quite a list. Any nausea, vomiting, or changes in your bowel habits?
No vomiting. Nausea, a bit, especially in the mornings. Bowel-wise, it fluctuates. Sometimes normal, other times constipated. I thought maybe it was dehydration or something, so I started drinking more water. But no consistent improvement.
All right, Mihira. Can you tell me a bit about your daily routine, your lifestyle?
Sure. I work in digital marketing, so I'm at a desk most of the day, sometimes 10 hours straight. My boss is demanding, and lately, deadlines have been insane. My sleep is all over the place. I'll fall asleep around midnight and wake up groggy at 7 or 8. I use my phone a lot before bed, scrolling or answering work emails. I know it's bad. And I've been skipping breakfast more often, which I never used to do. I try to squeeze in some yoga twice a week, but it's been sporadic.
Got it. And have you tried anything to manage these symptoms yourself?
Yes, I cut dairy for a few weeks thinking it was lactose intolerance. No change. I even tried herbal teas, peppermint, ginger, chamomile, and probiotics. I bought these capsules from the health store. They might have helped a little with the bloating, but not consistently. I've also been using a hot water bottle on my stomach every night. I'm basically throwing things at the wall now.
All right, Mihira. Based on everything you've told me, the irregular eating, the stress, the disrupted sleep, and the gastrointestinal symptoms, this sounds like a classic case of stress-related eating disorder, possibly functional abdominal bloating linked to cortisol fluctuations. It's not uncommon, especially in high-pressure work environments.
Oh, wow. So, it's basically stress?
Yes, Mihira, it appears to be. Your eating patterns and digestive discomfort seem reactive to emotional and occupational stress. What we need to do is interrupt the cycle.
Okay, how?
First, we'll start with behavioral modifications. That means structured meals, 3 a day, ideally with high fiber content to stabilize blood sugar. No more skipping breakfast. Second, hydration is good. Keep that up. Third, we'll look at sleep hygiene. No screens 1 hour before bed, fixed bedtime, and possibly melatonin supplements if needed.
Got it.
I'll also refer you to our in-house dietitian for a nutritional assessment. They can help tailor a low FODMAP or anti-inflammatory eating plan if needed. Also, I like you to begin keeping a food and symptom diary. That way, we can track patterns and pinpoint triggers.
Sounds good. Do I need any medications?
Not at this stage, Mihira. If symptoms persist or worsen, we'll do bloods and maybe a referral to gastroenterology. But for now, focus on the stress management side. I recommend short guided meditations twice daily. There are some excellent apps and gentle exercise daily, even a 20-minute walk.
All right. And if nothing improves?
If there's no significant improvement within 3 to 4 weeks, I'll book you in with Dr. Wiles for further evaluation, possibly a full GI workup or endocrine screening.
Okay, thank you.
You're welcome, Mihira.
Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. You hear a nurse called Mihira talking to a doctor. Now read the question.
Good morning, Dr. Harrison. I wanted to give you an update on Mr. Peterson in room 302. He's been presenting with some rather persistent gastrointestinal discomfort. He reported intermittent epigastric pain, especially postprandially, but it's not localized to the right upper quadrant as much as we initially suspected.
Right, Mr. Peterson. I recall he was admitted for observation regarding those recurrent syncopal episodes, wasn't he? We were ruling out cardiac arrhythmias, though his ECGs have been remarkably unremarkable. Any new developments on that front, Mihira?
The syncopal events seem to have abated since we adjusted his antihypertensive regimen, so that's less of a concern now. However, his nausea is quite pronounced. He mentioned it's particularly troublesome in the mornings, sometimes leading to emesis, though his intake has generally been adequate. We've been monitoring his fluid balance closely. He also described a dull ache in his lower back, which he attributes to his long commute, not a new symptom apparently. The key, however, seems to be the increasing frequency of his abdominal distension. He feels quite bloated after meals, which is new, and this is what we're keen to address.
So, Mihira, the predominant issue now is the postprandial distension and morning nausea. It sounds like we need to pivot our focus.
Exactly. He's had a history of irritable bowel syndrome, but this feels different, more acute.
You hear a nurse called Mihira talking to a dietitian. Now read the question.
Good morning, Sarah. I wanted to touch base regarding Mrs. Davies in room 410. Her recovery from the hip fracture has been progressing, but we're encountering some challenges with her nutritional intake.
Morning, Mihira. Yes, I saw her chart. She's been on a high-protein diet since admission, primarily to aid tissue repair. Are we seeing issues with compliance or absorption?
Initially, it was a palatability issue. She found the supplements quite chalky. We've managed to switch to a more palatable liquid formulation, and that's improved her compliance significantly. However, she's now complaining of persistent nausea, especially after consuming the larger protein portions. We've tried spacing out her meals more, but the nausea persists. Interestingly, she also mentioned a metallic taste, which I initially linked to a new iron supplement, but that's since been discontinued. Her blood work last week showed good albumin levels, so malabsorption isn't our primary concern. The main issue now is her aversion to fats. She's pushing away anything with even a moderate fat content, and this is severely impacting her overall caloric intake, hindering her progress. We're losing the battle on calorie density.
I see. So Mihira, despite the protein compliance, the fat aversion is the significant barrier. That certainly complicates achieving adequate energy for recovery.
Precisely. She's losing weight, not gaining. Her muscle mass is barely holding, which is paramount for her rehabilitation.
You hear a trainee doctor called Mihira talking to a nurse. Now read the question.
Good morning, Emma. I'm just reviewing Mrs. Henderson's chart, room 205. I noticed a slight dip in her blood pressure readings this morning, around 90/60. She was admitted yesterday for a routine elective cholecystectomy, and her pre-op vitals were perfectly stable.
Good morning, doctor. Yes, I saw that. It was a transient dip, though. She's now back up to 110/70. We initiated the post-operative fluid regimen as prescribed, so she's had her first liter of Hartmann's. Her pain scores have been well controlled with the PCA, remaining at a 3 out of 10. We also observed a mild elevation in her temperature overnight, 37.8 degrees Celsius, which we're keeping an eye on, but no other signs of infection yet. The primary concern at present, which is why I was going to call you, is her urine output. It's been significantly lower than anticipated since this morning, registering only 150 milliliters in the last 4 hours, despite adequate fluid intake. This is quite concerning given her post-operative status.
Right, the oliguria. That is certainly worth investigating. We need to ensure adequate renal perfusion post-surgery.
Precisely. Her drain output is minimal, as expected, and her abdominal assessment is soft, non-tender, so Mihira, no immediate signs of a hematoma impacting renal function.
You hear a physiotherapist called Mihira talking to a nurse. Now read the question.
Good morning, David. I was just reviewing Mr. Jones's progress in room 512. We've been working on his ambulation post-stroke, and while his left-sided weakness is improving, his balance is still quite compromised.
Good morning, Mihira. Yes, he's been very diligent with his exercises. We've noticed he's much more stable with the quad stick now than when he first arrived. His dysphagia has also improved significantly, so his oral intake is much better. He did have a slight issue with constipation yesterday, which we've addressed, but that seems resolved. The key concern, however, and what's really hindering his discharge planning, is the persistent ankle equinus deformity on his affected left side. Despite consistent passive range of motion exercises, we're seeing very limited dorsiflexion, which is making independent transfers extremely challenging and significantly increasing his fall risk.
Yes, the plantar flexion contracture. I've been noticing that too. It's a significant impediment to achieving a functional gait pattern.
Precisely. We're finding it difficult to get his foot flat on the floor during standing pivots, and it necessitates much more assistance than we'd ideally like for his level of overall strength. This is really impacting his ability to safely manage his own toileting, for example.
You hear a nursing manager called Mihira talking to a nursing team. Now read the question.
Good morning, everyone. Let's get through our brief for today. Firstly, a quick update on the new electronic charting system. There have been a few teething issues, particularly with medication reconciliation, but the IT team is working on hotfixes. Remember to double-check entries manually for now. We also need to reinforce hand hygiene compliance. Audits show a slight dip in adherence rates, especially during peak hours. On another note, patient satisfaction scores from last month's survey were excellent for communication, which is fantastic, so keep up the great work there. However, we've had a recurring feedback theme regarding delays in discharge summaries reaching primary care. This isn't just about efficiency. It impacts patient continuity of care and follow-up appointments. This issue with discharge documentation is becoming a bottleneck and requires our immediate collective attention to streamline the process.
Yes, Mihira. I've noticed a few times where I've been chasing doctors for signatures, which adds to the delay.
And sometimes the administrative staff are swamped, which also slows things down at their end.
Exactly. It's a multifaceted problem, but it's crucial we resolve it. Our reputation hinges on it. We'll be reviewing the workflow, and I'll be reaching out to medical records and the physicians' offices to find a systemic solution.
You hear a nursing manager called Mihira talking to a surgeon. Now read the question.
Good morning, Dr. Davies. Do you have a moment? I wanted to briefly discuss an observation from the surgical ward.
Good morning, Mihira. Of course, what's on your mind?
Well, we've had a few instances this week where postoperative pain management protocols aren't being followed as consistently as we'd like. Patients are reporting higher pain scores than anticipated, even with prescribed analgesia. This isn't across the board, mind you, and we've ruled out issues with medication availability or administration errors by the nursing staff. We also had a minor incident yesterday with a missing consent form for a relatively routine procedure, though that was quickly rectified. The core issue, however, appears to stem from a lack of clarity in some of the postoperative orders regarding PRN pain medication dosages and frequency, particularly for patients undergoing more complex abdominal surgeries. It seems there's ambiguity in the parameters for escalation, leading to nurses being hesitant to administer additional doses without explicit clarification.
I see. So it's not a reluctance to give medication, but rather an uncertainty about the precise parameters for increasing it?
Nurses are frequently calling registrars for clarification, which delays patient comfort. This ambiguity is creating hesitancy, causing the lag in effective pain control.
Part C. Extract 1. Questions 31 to 36. You'll hear an interview with Dr. Mihira.
Welcome Dr. Mihira, a highly respected consultant surgeon and lead researcher, to discuss her groundbreaking work in robotic-assisted surgery. Dr. Mihira, thank you for joining us.
It's a pleasure to be here, David. Thank you for the invitation.
Dr. Mihira, your research has garnered significant attention, particularly your recent publication in the Journal of Advanced Surgical Techniques. Could you begin by giving our listeners an overview of the specific niche within robotic surgery that your latest study addresses? We understand it moves beyond merely demonstrating feasibility.
Absolutely. While the initial wave of robotic surgery research rightly focused on proving its safety and efficacy across various specialties, from urology to general surgery, my team's current work delves into the nuances of patient recovery pathways following complex abdominal interventions, specifically focusing on pancreaticoduodenectomy or the Whipple procedure, performed robotically. We're not just confirming that it can be done. We're meticulously analyzing the subtle physiological and psychological advantages for the patient when a robotic approach is employed, compared to traditional open surgery and even standard laparoscopic techniques. Our hypothesis was that the precision afforded by robotics would translate into a demonstrably smoother postoperative course, characterized by reduced inflammatory markers and potentially an earlier return to baseline functional status. This goes beyond just hospital stay duration, encompassing factors like analgesic requirements, gastrointestinal motility resumption, and even aspects of perceived well-being.
That's a fascinating distinction. So you're looking beyond the operating theater itself into the patient's holistic recovery. Moving on, what were some of the most challenging methodological hurdles you encountered during this extensive research? Dr. Mihira, I imagine gathering such granular data for complex procedures presents its own unique set of obstacles.
You've hit the nail on the head, David. Data acquisition was indeed paramount and incredibly intricate. One significant challenge was standardizing surgical team experience. To mitigate confounding variables, we only included procedures performed by surgeons with a minimum of 50 robotic Whipples under their belt, ensuring proficiency wasn't a variable influencing outcomes. Another substantial hurdle was the accurate and continuous monitoring of postoperative physiological parameters without causing undue discomfort or burden to the patients. We utilized a combination of non-invasive wearable sensors for continuous heart rate variability and sleep pattern analysis, alongside conventional blood tests for inflammatory markers like C-reactive protein. Patient-reported outcomes, such as daily pain diaries and quality-of-life questionnaires, also formed a crucial component, and ensuring consistent, unbiased reporting required meticulous training of our research nurses. The sheer volume of data generated from each patient necessitated robust bioinformatics support for analysis, which was a constant, evolving challenge. We found that patients were generally very keen to contribute, understanding the long-term benefits of such detailed data, which was a real motivator for us.
That sounds like a monumental undertaking. With such meticulous data collection, were there any surprising findings, Dr. Mihira? Or perhaps an unexpected outcome that challenged your initial assumptions about the benefits of robotic surgery?
Yes, there was one particular aspect that genuinely surprised us. While we anticipated reduced blood loss and shorter hospital stays, which our data indeed validated, we observed a statistically significant, albeit subtle, improvement in early postoperative cognitive function in the robotic cohort. This wasn't something we had explicitly hypothesized. Our initial thought was that the smaller incisions and reduced surgical trauma would primarily influence physical recovery. However, patients undergoing robotic surgery reported feeling mentally sharper, with less brain fog, in the immediate postoperative period compared to the open surgery group. We're now hypothesizing that this could be linked to a reduced systemic inflammatory response, translating into less central nervous system impact, or perhaps even less opioid-induced cognitive impairment due to lower analgesic requirements. This finding has opened up an entirely new avenue for future research, looking specifically at neurocognitive recovery post-surgery.
That's truly fascinating, an unexpected neurocognitive benefit. It speaks to the broader impact of surgical trauma. Dr. Mihira, could you elaborate on the implications of your findings for current surgical practice? How might this research directly influence clinical decision-making or even training protocols for aspiring robotic surgeons?
The implications are multifaceted, David. Firstly, our robust data on enhanced patient recovery, particularly the reduced inflammatory response and faster return of gut function, provides a stronger evidence base for advocating robotic approaches in appropriate cases, especially for patients who might be more vulnerable to postoperative complications. It reinforces the idea that it's not just about successful removal of pathology, but the quality of recovery. Secondly, in terms of training, our focus on precision and the nuances of robotic manipulation suggests that future training curricula should emphasize not just the technical dexterity, but also an understanding of how these precise movements translate into improved patient physiology. It underscores the importance of minimizing tissue handling and meticulous hemostasis, aspects that robotic platforms facilitate. It also prompts discussions around resource allocation. Justifying the significant capital investment in robotic systems requires compelling evidence of patient benefit, and our research contributes to that body of evidence.
And looking ahead, Dr. Mihira, Where do you see the future of robotic surgery research heading, particularly building upon the insights from your own studies? What are the next big questions your team, or the field in general, hopes to answer?
The landscape of robotic surgery is evolving rapidly, and our work is just one piece of the puzzle. Moving forward, I believe the next frontier lies in integrating artificial intelligence and machine learning more deeply into robotic platforms. Imagine a robotic system that not only assists with precision but also provides real-time interoperative feedback based on AI analysis of tissue planes, vascularity, or even predictive analytics for potential complications. We're also keen to explore the long-term oncological outcomes of robotic surgery for various malignancies, beyond just immediate recovery parameters. Comparative effectiveness research, pitting different robotic platforms against each other, will also be crucial. Furthermore, the role of virtual reality and augmented reality in surgical training, allowing aspiring surgeons to hone their skills in incredibly realistic simulated environments, is another exciting area. Ultimately, the goal is to continuously refine these technologies to optimize patient outcomes and expand their accessibility.
That sounds like a future where surgeons and robots truly collaborate in an unprecedented way. Dr. Mihira, your insights have been incredibly illuminating. Thank you once again for sharing your invaluable research with us today.
My pleasure, David. It was a productive discussion.
Now look at Extract 2. Questions 37 to 42. You hear a nursing manager talking about the team's strength at the Mihira Research Institute.
Good morning, distinguished colleagues, esteemed researchers, and our dedicated clinical staff. It's a profound privilege to stand before you today at the Mihira Research Institute to discuss a topic that forms the very bedrock of exceptional patient care and, indeed, the success of any medical institution, nursing team strength. At Mihira Care, we believe this isn't merely a buzzword. It's a measurable, cultivable asset. So, let's begin by defining what we mean by nursing team strength in the context of a high-acuity research environment like ours. It extends far beyond simply having adequate staff numbers, though that is, of course, a fundamental prerequisite. True nursing team strength at Mihira Care encompasses the collective proficiency, resilience, and synergistic collaboration of our nursing professionals. It's about the depth of clinical expertise across various specializations, the adaptive capacity of individuals and groups to respond to complex and rapidly evolving patient needs, and crucially, the psychological safety and trust that underpins effective communication and mutual support. It's the intrinsic ability of the team to function as a cohesive unit, anticipating challenges and proactively mitigating risks, rather than simply reacting to crises. This holistic definition emphasizes not just individual competence, but the dynamic interplay between team members, fostering an environment where every nurse feels empowered and valued in delivering Mihira care. Now, how do we scientifically rate this seemingly abstract concept of nursing team strength? At Mihira Care, we employ a multifaceted approach. We move beyond simplistic nurse-to-patient ratios by incorporating metrics derived from patient outcomes, such as rates of preventable adverse events, hospital-acquired infections, and readmission rates. Beyond these clinical indicators, we utilize validated psychometric tools to assess team cohesion, job satisfaction, and burnout rates. Furthermore, we leverage qualitative data from structured peer evaluations, interprofessional feedback loops, and incident reporting analyses to identify areas of both exemplary performance and potential weakness. Our sophisticated data analytics platform at Mihiraa Research Institute allows us to correlate these diverse data points, everything from unit-specific turnover rates to the frequency of critical safety huddles, to construct a comprehensive team strength index. This quantitative and qualitative synthesis provides a robust framework for benchmarking and continuous improvement within Mihira Care, ensuring we're not just guessing about our team's capabilities. The importance of a robust nursing team strength, particularly in a cutting-edge facility like Mihiraa Research Institute, cannot be overstated. A strong nursing team is not merely a component of quality care. It is the catalyst for its consistent delivery. It directly impacts patient safety by reducing medication errors and preventing complications through vigilant monitoring and proactive interventions. Beyond immediate safety, it fosters a healing environment, contributing to improved patient satisfaction scores and faster recovery times. Economically, strong teams lead to reduced staff turnover, decreased recruitment costs, and fewer costly sentinel events. Critically, in a research setting, a resilient and knowledgeable nursing team is indispensable for the accurate execution of complex research protocols, the meticulous collection of clinical trial data, and the ethical safeguarding of patient participants. Without a strong nursing team at Mihira Care, the translational research we conduct would simply not be possible. Building nursing team strength is an ongoing, deliberate process, not a one-off initiative. At Mihira Care, it starts with strategic recruitment, ensuring we attract individuals who align with our values of excellence and collaboration. However, the true building blocks are laid through comprehensive orientation programs that extend beyond basic skills to include mentorship and peer buddy systems. Continuous professional development, including specialized training in advanced nursing practices and research methodologies pertinent to Mihiraa Research Institute, is non-negotiable. We foster a culture of open communication and psychological safety, encouraging staff to voice concerns and contribute innovative ideas without fear of reprisal. Empowerment is key, devolving decision-making authority where appropriate and providing opportunities for leadership development at all levels strengthens individual and collective agency within Mihira Care. We also actively promote interdisciplinary collaboration, ensuring nurses feel integrated into the broader clinical and research teams. Maintaining nursing team strength, once established, requires vigilance and adaptability. At Mihira Care, we prioritize regular, transparent feedback mechanisms, both formal and informal, to address challenges proactively and celebrate successes. We implement robust wellness programs, including access to mental health support and stress reduction initiatives, recognizing the demanding nature of our profession. Fair and equitable workload distribution, supported by intelligent rostering systems, is crucial to prevent burnout. Furthermore, we consistently invest in technological upgrades and ergonomic improvements, empowering our nurses with the best tools and environment to deliver Mihira Care efficiently and safely. Recognizing and rewarding excellence through both formal recognition programs and informal appreciation is also vital for morale and retention. It's about cultivating a perpetual cycle of growth and support. Ultimately, the impact of nursing team strength on patient care at Mihira Research Institute is profound and pervasive. A strong team translates directly into enhanced clinical outcomes, reduced rates of complications, shorter lengths of stay, and improved patient functionality post-intervention. It leads to greater patient satisfaction as patients feel more supported, informed, and cared for during their journey at Mihira Care. Beyond individual patient benefits, it contributes to a safer, more efficient healthcare system overall. In a research context, a robust nursing team ensures the integrity and reliability of clinical trial data, directly influencing the validity of new medical discoveries. It cultivates an environment of continuous learning and improvement, where best practices are swiftly adopted and innovation flourishes. The nexus between a cohesive, skilled nursing team and superior patient care is undeniable at Mihira Care. It is the very engine of our mission.